Hello, my name is Ethan Zamora. I am a student at Stanford University in Riverside, and I'm here to tell you about blood pressure monitors like this one, as well as glucometers. And I'm going to as well explain to you how to administer medication to patients with hypotension, hypertension, as well as diabetes type 1 and type 2. So the reason why I'm doing this speech is because even though it sounds like common sense giving medication to a patient, some people do mess up and it can cause bad things to happen, such as a patient overdoses and passes away. The patient can sue the patient's family can sue you afterwards, after their, relative or loved one passed away. Um, just basically showing you exactly how you should be administering these medications to the patient. So, first one I have here is insulin. So, say you need to administer 30 units to the patient. So before you do that, you need to check their blood glucose to make sure that they're able to take this insulin in without like anything bad going on. Say if their blood sugar is way too low and you give them insulin, that will only decrease their blood sugar even lower, which will cause worse things to happen for the patient besides them already having diabetes. So with this glucometer, you take this out and you take out one of these little test strips. You get the test strip, you plug it into the bottom of there, and as that's already plugged in, you need to get your alcohol pads. You wipe it on the spot where you're going to, inject the insulin. You can do it either on your arm, like your deltoid. You can do it on your thighs. You can do it on your stomach right here. Do it in many different places. It really depends on where you want to do it. So, checking it. This is your lancet. This is what you use to prick your finger to get the blood out. And I don't have a lancetting device on me right now, but that is a very important thing because that is what you use to actually prick your finger with the lancet. So after you do all the alcohol pads, then check your blood glucose, make sure your blood glucose is good, and then you use your syringe, inject it, and make sure you inject the right amount and follow the directions as well. So for the next one, for hypertension, well, you can just give the medication out to the patient, like you can just so you can, with hypertension or hypotension, you can give the patient the medication and have them take it. I have one medication right here called DILT-XR. It's diltiazem hydrochloride extended release capsules. This is to help with blood pressure. Okay, so if you're gonna administer a medication to a patient that decreases their blood pressure, you have to make sure that their blood pressure is actually high and not too low or not regular. Because if you were to give them a medication that lowers their blood pressure and their blood pressure is already normal, it's not very good. It's gonna go way too low, and you're gonna cause the patient to either have a heart attack or something along those lines. Although patients are bedridden and such, we're going to have Damien here act as a bedridden patient. So patients can be bedridden and they get very cranky and they won't want to take their medications. They're very basically self-reflecting onto us. So say a patient has been sitting in the bed for about 2 years now over COVID while I was working there. They were in the bed for 2 years. They had all locked down. No family could really visit them unless they stood at the door with a mask, and we had to check their temperatures and all that. They get very cranky, so they want to be non-compliant with you. So if you're trying to give them food, if you're trying to give them medication, they won't want to take it. The most important one is the medication, because if they don't want to take it, say their blood pressure is way too high, or their their blood sugar is way too high, and they need the medication to lower the blood pressure or blood sugar, and they don't want to take it, you can't force them to take it. You have to explain to them why they need to take it or why it's important for them, and if they still refuse, then there's nothing you can really do. You have to write it down, take notes, and record the data saying that they did not want to take this medication. It happened a few times where the patient does not want to take the medication, especially for blood pressure. They don't like the blood pressure medication for some reason. All right. So, say Damien here is a patient at our boarding care and needs to take medication for his hypertension. So, after we check his blood pressure, which we could do with this watch right here, we check his blood pressure, make sure it's, well, not really make sure, we got to make sure that it's in the range to where we can give him medication and it'll lower it. And hopefully it's already low enough, but most of the cases it's not because they have hypertension. So, after we do that, sometimes if say he doesn't want to take it, I have to be like, hey, Damien, come on now, you gotta take the medication. Even though you may not want to, you got to. Like, it will help lower your blood pressure because, you know, if you don't take it and your blood pressure is way too high, you're at risk of a heart attack.
And I could possibly die.
Exactly. So, always try and make sure that these patients take their medication. For Damien right here, we can test his blood pressure just by using this watch right here. It will show us in just a moment what it is. So it is 116/78. So that means that it is still in the normal range. The normal range goes from 120 to about 80. 120/80. So because of that, he doesn't need to take any medications such as like losartan, like Betalol, like you know, benazepril, just some medications for helping the patient with their issue. So it's not just with hypertension. Also, diabetic patients don't want to take sometimes their insulin because, I mean, you're being injected, and some people don't really like injections, so they would deny it sometimes. I've had it happen before. They would just be like, I don't want to take my medication, I don't want to take insulin. But it's crucial that these patients take it because without it, they're going to pass away. They're going to croak, basically, which is not good because, I mean, you're losing a life as well as, you know, a person, your patient. It's not cool. Okay, so I'm going to do this. So right here, we have our different kinds of blood pressure. We have the range of normal, which is less than 120/80, while elevated is from 120 to 129, and less than still 1/80. And then high blood pressure or hypertension stage 1, that occurs from 130 to 139 over 180 to 189. So having hypertension stage 2, this is even more severe. You can have it from it will be ranging from 140 and higher over 90 or higher. Now, the most severe case of hypertension is this hypertensive crisis. This is, you have to call your doctor immediately or go to an ER. This is if your blood pressure is higher than 180/120. Usually at this, people can have a heart attack, and after they have their heart attack, their blood pressure is just going to drop straight down. You can't even read it anymore. Or if their blood pressure is way too high, it will even sometimes say error, and it won't give you a reading exactly of what their blood pressure is. So, to conclude my little presentation here, you always have to make sure that you are patient with your patients. Patience is very key to developing a good relationship with your patient, because if a patient is giving you a hard time and you need to calm the situation down, being impatient and kind of pushing how you feel onto the patient is not good. Say you need to take your medication right now. So they're not going to like that. You got to be more of, hey man, you got to take your medication, because if you don't take your high blood pressure medication, you're at risk of having a heart attack.
Oh, for sure. I don't want to die.
You see? Being patient is not so hard. And being patient is very important, because having that bad relationship with your patient, telling them, becoming impatient with them and forcing them to do things that they don't want to do would not be very good for your business or for you in general. So, yeah, there's my speech.